Hi, my name is Tal from the American Academy of Functional Health, and I wanted to share with you this mini class on how to create a wellness plan for a patient with osteoarthritis. This is a mini class from our functional and integrative medicine program. In this class, we really want to focus on what are the steps, and if we can call it phases, where we create a comprehensive plan for your patient. So, as we all know, in the functional medicine approach, we are looking at the root causes of chronic conditions. So in this case, when a patient comes to see you in your practice or come to you in a private consultation, maybe virtually or in person, we want to always start by asking, what is it that is driving the chronic inflammation and leads to or contributes to the development of osteoarthritis. We know that osteoarthritis is a degenerative condition, and inflammation is one of the key players in the destruction of our joints. We always talk about how inflammation, when you have ongoing chronic inflammation, you also have oxidative stress, which means that you have reactive oxygen species that are constantly attacking our joints in the case of osteoarthritis. So going beyond the normal wear and tear or acute injury, osteoarthritis is an inflammatory condition. So we start by asking ourselves, what are the root causes that can lead to osteoarthritis? As an example, that could be the patient's diet, the patient's environment, changes in their gut, changes in cellular function, some genetic predisposition, right? There could be multiple factors that will typically play a role in the development of chronic degenerative joint pain. So from there, we move into developing a wellness plan because the patient in front of you are coming to seek answers for their pain. This is where we're going to go into the 6 principles of how to promote health with functional and integrative medicine. So with functional medicine, we mostly focus on identifying what's driving the disease pathophysiology, what's driving the inflammation. In the more integrative approach, we're going to talk about the 6 principles to promote health. Those are, of course, anti-inflammatory foods and diets, maintaining physical activity, sleep, quantity and quality. We're talking about stress relief and healthy relationships. We're talking about nutrients, specific nutrients for each condition and herbs that can help support healthy function, right? In the case of osteoarthritis, we want to, of course, reduce inflammation. We also want to support the healing process, right? So we have inflammatory components that are there to try to rebuild the joint. We want to support the natural regenerative process. And I'm going to share with you an example of some supplements or nutritional compounds that there's some really great evidence for benefiting patients with degenerative knee conditions. And then, of course, as an example for functional medicine, root cause, we're going to talk about healthy gut function because, as we know, there's more and more diseases that are starting in the gut. So I'm going to share with you how to create a wellness treatment plan for a patient with osteoarthritis. I'm going to break it down into phase 1 and phase 2. And in each one of those, we're going to see the specific dietary recommendation, example for supplements, example for how would you create that for your patient when they're coming to see you and they have osteoarthritis. So enjoy the video. And as usual, when you have comments, you have questions, what other challenges do you have with patients with osteoarthritis? Let us know in the chat, let us know in the comments section so we can continuously create more of these educational videos to help you, to bring you more clinical strategies and professional tips to help your patients. If you're interested in more information about our advanced functional and nutritional and integrative medicine programs, reach out to us if you have any questions. And as usual, if you enjoyed this video, please share it with others so it will help us with our mission to change healthcare and transform patients' health. Thank you and enjoy. Let's take another example, which is different. For a patient that comes to see you with chronic knee pain. Now, this could be chronic back pain, this could be chronic shoulder pain, any type of chronic inflammatory condition. So, let's talk about, this is a male come to see you. He's divorced with 2 children. Both knees are hurting for over a year, especially when trying to walk more than 10 minutes or exercise. His doctor reported that he has mild degeneration and prescribed him with pain medication. He said that he's still not yet a candidate for knee replacement, but he's got pain and he's got degeneration. Occasional bloating, discomfort, and gas after meals in the last few weeks. In the last few months, he occasionally felt mild lower back pain and takes ibuprofen or Advil to alleviate the pain on a daily basis. His diet is healthy, as he describes it, and which healthy doesn't always mean healthy. Healthy means different things to different people, healthy diet. And he says that he tries to eat a variety of vegetables and eat sandwiches. He loves eating sandwiches with chicken. Emotionally, he tends to spend most of the time by himself. Now, we already talked about loneliness, right? And how loneliness is associated with higher levels of inflammation. So we're starting to create those connections in our head. And then sleep, he wakes up due to pain occasionally, and he wants to go back to being more active. And so when you look at this report by this patient, you can already start to understand that he's got chronic inflammation causing him pain, because it's not just the degeneration. It's mostly the inflammation that will cause joint pain, right? Some individuals might have degenerative joints, but they might not have pain. Why is that? Because they don't have inflammation, right? So inflammation equals pain. So we know he has inflammation. Inflammation also leads to increased degenerative conditions. Occasional bloating, discomfort, or gas after meals. What can that be caused by? Lower stomach acid can cause that. Can also be caused by harmful bacteria, which ferment the food. But if it happens between 30 to 60 minutes after a meal, it's most likely low amounts of hydrochloric acid in the stomach. If it happens an hour and a half, 2 hours and after the meal, then it could be caused by harmful bacteria that are just fermenting the carbs and causing gas. Remember that there is no mechanism in our body that can produce gas. Our gas is produced by bacteria. If there is bacteria overgrowth, you can suffer from more and more discomfort and gas. So what do we do with this patient? We want to look at the 6 principles. And so let's look at those principles. The first principle is the anti-inflammatory diet and food, which means replacing chicken. We got to replace chicken with fish, because chicken is going to be higher in omega-6, right? And so that might trigger more inflammation or be pro-inflammatory, while fish is higher in omega-3, so that might be more beneficial. So we want to help him replace that. For 2 or 3 times a day, we ask him to buy fish and eat fish or seafood. We also want to introduce vitamin C, 500 milligrams twice a day, because vitamin C is helpful for supporting healthy immune function, and support the healing process of the joints. Without vitamin C, adequate amounts of vitamin C, most tissues in our body cannot regenerate properly, and that's really important to mention. We want to introduce a gratitude journal, so write 3 things or 3 people that he is grateful for every day. Which herbs will we use with this patient, right? We can use curcumin, we can use Boswellia. Using them together will bring great benefit for this patient, because curcumin can actually reduce harmful cytokines such as interleukin-6, and it can increase beneficial cytokines such as interleukin-10. Boswellia blocks an enzyme that causes more inflammation and migration of inflammatory cells into the joint, so this is going to be a good combination. And then hydrochloric acid, betaine hydrochloric acid, and pepsin. Supplement with meals to support digestions. Not small meals like an apple, but bigger meals to help break down properly the food. We want to introduce some supplementation of hydrochloric acid. And licorice root, 50 milligrams per day to support healthy gut lining. Why would we support healthy gut lining? Because how does NSAIDs, non-steroidal anti-inflammatory drugs, impact our gut lining. Those drugs can cause anything from stomach ulcers to damage to the barrier, the mucosa of the gut lining. So it's really important to make sure that we help them address that. And licorice could be helpful as 50 milligrams a day. So they can buy a supplement as 50 milligrams, or they can buy 25 milligrams and take it twice a day. That might be more beneficial. And then physical activity. First month, 10 to 15 minutes of stationary bikes without resistance or walking every day. So if you can't be active as much as you want, you can just sit at home and buy those $30 or $50 stationary bikes and just sit in front of the TV and we want to create some sort of movement, right? That's going to be important. All right, patient came back after a month or 2 weeks, and that's where we're going to start introducing more greens, replacing wheat with gluten-free, because remember that gluten can lead to secretion of zonulin in the stomach and increase inflammatory marker, increases also intestinal permeability. We also want to remove nightshades for a couple of weeks and see if there is a reduction in the inflammation, in the pain. Because some individuals might significantly benefit from reduction of nightshades. Some will not, but we want to try it at least for 2 weeks. Schedule a small social activity once or twice a week. So that could be fishing with a friend or joining a class, because we understand that this patient is divorced, like to spend a lot of time by himself, and he might be an introvert, right? And that's okay. But even introverts need social interaction. It's really, really important. So what is the one thing that this patient can do to start being more social, right? Maybe joining a club, like maybe a class, or maybe meeting with a friend in a restaurant once in a while, right? So we got to constantly think about what we can do to put him in that place, being more social. And then bromelain, 200 milligrams twice a day. It's a wonderful antioxidant that also helps to reduce inflammation. Glucosamine sulfate and chondroitin sulfate, about 1,000 milligrams each every day, to help to regenerate the joints. That's going to be really helpful. Remember that with those supplements, patients need to be on them for at least 3 to 6 months minimum to really start noticing the changes. While some patients might come back already after 2 to 4 weeks and tell you that with curcumin and Boswellia, they already feel less pain, less inflammation, they feel better. Patients have chronic conditions. It will typically take 3 to 6 months to start noticing the changes. It's important to let them know that regaining their health is a slow process. And it probably took them years in the making to develop disease. And it's going to take probably months to years to regain their health, right? So they need to know about it, be aware of it in advance. And then we want to introduce omega-3, which is anti-inflammatory. L-glutamine, 5 grams a day, is important to modulate intestinal permeability, reduce inflammation, and support the healing of the intestinal lining. Second or third month, we want to start having low-impact activity, like swimming. As soon as that inflammation reduces, patients feel better. We want to do like low-impact activities, start having them more active on an ongoing basis. Now, nightshades, vegetables as we know it, it's potatoes, eggplants, peppers, tomatoes. With some individuals, they can cause more inflammation. Your personalized health plan should include 6 components: anti-inflammatory foods, stress relief, herbs, nutrients, healthy gut function, physical activity, and sleep quality and quantity. Sleep is very important. We talked briefly about it with all the clinical studies. You can use melatonin. You can dim the lights. Patients should stop watching TV or electrical devices before they go to sleep. So you gotta have to prepare yourself into going to sleep.